Wonderful, thank you. And close that up there then. So thank you very much, everybody, for joining us today for our first look at the Longevity Ready Maryland goals, objectives, and strategies, and also our data dashboard. My name is Liz Woodward. I'm the Assistant Secretary for Planning here at the Department of Aging, and I'm leading our Longevity Ready Maryland initiative. The aim of today's meeting is to share our key Longevity Ready Maryland products that are in develop with our work group members, our stakeholder advisory group, and our key partners to keep you updated on the process, share the steps that we have taken since our work groups ended in November, and prepare you to consider your potential role in future planning and implementation of Longevity Ready Maryland. Please note this meeting is being live streamed for members of the public, and we're also recording it so folks can review later. All right, so today we're going to share with you where we are in the development of the plan. To do this, I'll briefly review the process to date and our upcoming timeline for creating the plan and beginning implementation. I'll provide an overview of the objectives and strategies to begin to familiarize everyone with what you can expect to be included in the plan when it's released to the public. And we'll preview next steps for implementation. Then Jonathan Jenkins from our team will provide a first look at our data dashboard. It's a product we've been developing with the Maryland Department of Planning. Following the session, you'll receive a link to the full text of the goals, objectives, and strategies for your eyes only, as well as a feedback survey to let us know what you think about what you have seen today and what you review on your own. We have a big agenda today, so we're asking everyone to enter questions and comments into the chat as we go, and we'll be looking there and answering verbal questions following each section of today's discussion. All right, you may remember our timeline. We've modified it a bit here to incorporate our full process. This process started in 2023 with the Department of Aging and a team of state leaders participating in the Centers for Healthcare Strategies Multi-Sector Plan for Aging Learning Collaborative. Then last January, Governor Moore signed the Longevity Ready Maryland Executive Order. And from then on, we've been engaging stakeholders, culminating in our work group convenings to develop recommendations for the goals, objectives, and strategies to include in our multi-sector plan on aging. You're here today because you had a key role in getting us to this stage. Thank you for being part of the process and for your continued engagement. Thanks for being here today. Moving forward from here, we're continuing to develop the full plan, which will be released to the public in March. We will then be incorporating feedback with the aim of having an active plan in place by July 1st. And then that's just the beginning. This plan is not made to sit on a shelf. It's made to guide our work as a state over the next 10 years and to be modified by continual assessment and planning during that period. Before we get into further into the plan, I want to share feedback that we received from the work group members about our engagement process. We distributed a 6-question post-work group meeting survey through a constant contact email from me to all participants. We received feedback from just over a quarter of participants with representation from all work groups, and most people were involved in a stakeholder advisory group that responded. And remember, the stakeholder advisory group members were also work group members. Most respondents held a positive view of the process, indicating satisfaction with the process overall, and that they were likely to participate in the future. We received feedback that the structure of the groups in itself was good, and that many especially found the work group, the subgroup discussions of the work groups rewarding and productive. We received a lot of feedback that the diversity of points of view and stakeholders was good, and also a lot of feedback that we must improve on diversity and inclusion. So greater inclusion of minority groups, as well as persons who are not affiliated with any organization, were mentioned as real opportunities for improvement. Finally, the limitations of our Google Drives and our Google Meet structure were noted, with some asking to meet in person. The most common feedback was to keep the work going, so that was really exciting and positive. We're really thankful to those of you who provided feedback via the survey, and also those of you who reached out directly to your work group lead or to myself. And we see a lot of opportunities for improvement, including and especially planning ahead to provide sufficient time for the things that we're trying to do, increasing the diversity of populations and sectors that are involved. And we can do that by assessing our application review process and reaching out to new community groups and organizations and sectors that we were not successful at including in this initial round. And we also want to create opportunities for in-person convening and especially greater guidance around online tools when we're going to be using them. Excuse me. So now we're going to get into the plan content. Throughout the presentation, I am going to share screenshots of key parts of the plan, of this portion of the plan that we're discussing, to familiarize you with the layout and the content without making you dizzy from just scrolling through it. So again, you will receive the link to this document after the meeting, and then you can review it at your own pace. The visuals here that are included on this slide are sample pages that reflect the design of the EPIC goals section in the overall plan. So first and foremost, it's important to understand the layout and the use of the entire plan and how this section of goals, objectives, and strategies that we're discussing today fits within that. So as you likely know, the Longevity Ready Maryland Plan is our state's 10-year blueprint for how we will collaborate across sectors to better prepare Maryland for falling birth rates and longer lives. The plan acts as both our state's multi-sector plan for aging and our state plan on aging, which is a document that the department is required to complete every 4 years to uphold our responsibility as the state unit on aging under the Older Americans Act. As such, as being this document, there are specific requirements that the plan must meet. So the goals, objectives, and strategies that we are reviewing today are one component that's required, and there are several areas within them that must be included. The overall plan incorporates several additional requirements that we're working on now that provide context for Maryland's challenges and opportunities, why and how the strategies were selected, and also how they will be carried out. What you will see today and receive as a link represents less than half of the plan's overall content that you will see released to the public. The other sections will outline our network, the data about Maryland's existing demographic and service landscape, our stakeholder engagement process, our stewardship and oversight of programming, and the implementation process. As you know, the plan is created by the Maryland Department of Aging, but it includes activities that are under the purview of other state agencies, including health, labor, human services, housing, and transportation, among others. So for this reason, the recommendations were reviewed with a careful eye for alignment with other state agency strategic plans, and the objectives and strategies were modified to ensure that the strategies are actionable for the state. The larger plan content will include a description of how the many state agencies contribute to preparing Maryland for longevity. And you can see here that our EPIC goals include the relevant sectors that we anticipate working with during implementation. Each EPIC goal is summarized within 3 pages. The first page, an example of which is included on this slide, starts with an overview of that EPIC goal. It includes a description, a value statement, data points, priority areas, a relevant mandate taken directly from the governor's executive order, and also links to key case studies that align with those priorities. I'll give a second just to look at the The next 2 pages in the 3-page section of each EPIC goal area include a set of objectives, includes the strategies, and the Older Americans Act outcomes that pertain to each objective. Also includes an initial version of the measures of success that can be used as key performance indicators during evaluation phases of implementation. So now we're going to dive into our review and modification of the recommended goals, objectives, and strategies. You may remember that we received recommendations for over 120 strategies across 16 objectives from the work groups. In this version that you'll review, we have included 75 strategies across 14 objectives associated with our 4 goals. The areas of focus are largely the same, with no changes to the 4 goals, and alignment with the focus areas as identified within the work group process. You'll note as you look at the content of the plan, the level of detail we asked the work groups to produce is missing. We heard your feedback loud and clear during the work group convenings, and we agreed. We think we're too early in the process for the specific, measurable, time-bound objectives we asked for. We decided we need to lay out the vision first. This plan is going to do just that. It'll lay out the vision for the next 10 years, highlighting areas for the Department of Aging and other state agencies, as well as local community organizations and local governments, and the private sector to collaborate on program, policy, and process adaptations that will begin to change Maryland's overall system to support healthy, long lives. So the language reflects this more visionary approach, and the specifics will come in our annual reports and information that's embedded online about implementation and tracking, and also future updates to the plan at 4-year intervals. So fear not. While these specifics that you worked really hard to research and document, and I know you did, they might not show up within the plan that you see in March or that you're going to receive via link, but they will be used to inform next steps, and you will see them reflected on our website and in our annual reports. So the next kind of impression outside of, wow, there's a lot here, is that, well, actually, sorry, that was the next impression we had, that there really is a lot here that we were reviewing in what we received, which was a great thing and exactly what we asked for. So, but we really did see an opportunity to review with an eye to consolidate. And in doing so, we were able to identify and bring together strategies that were embedded across all groups into some specific areas. So there are several examples of this that I think you'll see. I would say the largest one was the inclusion of strategies across every goal area to address the challenge Marylanders have accessing services. Every group noted that while there are services available, people often don't know about them or they struggle to access them. There are 2 places where I would say we brought these items together that I'm going to share here. The first is in the screenshot on this slide. It's an objective under Build a Longevity Ecosystem to improve equitable distribution of resources across state programs to historically underserved and marginalized communities. Here, our strategies outline the need to engage communities in the planning process. The strategies do establish opportunities to improve the distribution of resources to historically underserved populations, and they ensure that a lifespan approach is taken to state equity planning, of which much is going on. The second place we focused on access barriers is in an objective that we included under the goal of preparing Marylanders to afford longevity. The objective is to streamline access to public benefits and services. This objective includes strategies that will drive the assessment and modification of systems through which Marylanders can access information and assistance with benefits and long-term care. The strategies connect with this, and they also build upon a lot of work that the state has initiated around things like universal eligibility, access to Social Security and veterans benefits, screening for cognitive decline, and planning for long-term health and social care needs. I'm going to pause just to allow you to take a look at this for a moment. Okay, in reviewing and modifying the objectives and the strategies, we also worked to fill in some gaps. So while the work groups and stakeholder advisory group were our primary means for stakeholder engagement, the results of additional stakeholder engagement activities informed our review as well. For example, we went to every county in Maryland. We attended events and meetings. We also conducted focus groups with target populations, and we analyzed the most recent 4-year area plans from the area agencies on aging, who are our key partners. We reviewed the recommendations through the lens of that engagement as well to ensure that, that we could identify gaps and make sure that the plan is representative of the diverse needs and opportunities in our state. The details of those other outreach and analysis methods will be included in another area of the plan along with our work group process. You can see one of those gaps represented here. We heard across stakeholder engagement how important access to fresh, healthy food is to health, but we didn't see that represented in the objectives. So under the Optimize Health, Wellness, and Mobility goal, we added the objective to increase access to healthy food and physical activity. And we included strategies that aligned with the recently released State Health Improvement Plan that we think can help guide our multi-sector planning and service delivery. You can see another example represented here. The benefits of volunteerism was an important theme across stakeholder engagement. It is also a primary strategy within the governor's state plan. We believe that one of the greatest opportunities to harness the benefits and improve the health of an aging society is the reciprocal benefit of volunteerism, especially intergenerational volunteerism. So as is included in this slide, we have a new objective within the Build a Longevity Ecosystem goal to specifically address the opportunity to maximize the benefits of older volunteers across sectors. Another area where we adapted language to align with existing state government strategic plans was around older adult employment and the direct care workforce, where we integrated the recommendations we received with the strategic model in use by the Governor's Workforce Board. Finally, we used our expertise in Maryland's aging systems to identify opportunities to embed promising program models into the plan that aligned with the recommended objectives and strategies. For example, incorporating reference to such programs as the innovative neighborhood nursing model that's being piloted in our state, the village model, and co-housing, among others. So what's next? Going back to our timeline, you can see that we are drafting the full plan now, which we will put out to the public by mid-March. By participating in this first look, hopefully you will feel a little more prepared for the upcoming public release and will feel encouraged to help get the word out to your networks and make sure that our reach is extensive and that the public comment period really is meaningful, which is our aim. So we are asking you to share the full publicly available plan with your networks once it's posted online. The link that we'll be sharing with you pretty much directly after this presentation is not intended to be shared with the public. It's really for your eyes at this time because we're still in development. If you want to go a step further, you can also host a discussion session with your professional network or community groups, and you can provide consolidated feedback that would be very helpful to us at the Department of Aging as well. We're working on a toolkit to help facilitate independent convenings because we know that we're not going to be able to make it into all the spaces we would like to during the month-long public comment period. It's important to know that while we've been working on the plan, we have also already started to work on implementation. Implementation will include a lot of activities, the first of which is to get the word out. We want to further build our relationships with a variety of sectors, state agencies, local governments, community-based organizations, and community leaders so that we can build awareness of the plan, gain some buy-in for it, and get people excited about how they can use it strategically within their own communities. We'll work to begin specifying actions that can accompany these strategies. We're really starting here at home with our team at the Department of Aging, and we're going to be building a process upon that to gather information from our partner agencies, utilizing opportunities to gain information by going where it is already being shared, doing what we've been doing the whole time, building on what the state is doing already. We're going to be building out our key performance indicators and aligning that with our data dashboard and online reporting. We'll develop a timeline for educational and promotional communications that highlight the Longevity Ready Maryland strategies in action at all levels. So that means we'll be sharing what we do, what our partners do, and hopefully what you're doing as well. And we'll continue convening a stakeholder advisory group, incorporating additional individuals to enhance the diversity of our membership in terms of both population groups and sectors. And the plan will be used to further develop our policymaking agenda to guide our legislative and advocacy efforts, a huge focus right now. So that was a lot of information. I'm going to pause here before we move on to sharing the dashboard and take a few questions. I think we have almost 10 minutes for that. So if you have a question, please go ahead, raise your hand. You can put it in the chat and we can read it out there. No questions? Any comments?
Well, Ed Sullivan said, looking forward to receiving the draft plan and discussing with our AAAs and possibly provide feedback to MDOA. Appreciate the opportunity to review internally and be a part of the process. Thanks, Liz.
Thanks, Ed. Thank you so much for joining. And that's a great example of a way that you can bring your organization, your staff together to review and give feedback as a group.
We have a question, Liz, by Liz Briscoe. How do you plan to engage the local organizations in reaching marginalized residents?
Yeah, it's a great question. Thanks, Liz, for bringing that up. So I think it's hugely important that we all at the state and local level are engaging a variety of organizations so that we can reach folks. I would say in terms of, getting public input and feedback, that's what we're aiming to do. We've got a variety of area agencies on aging and other partners that have, traditionally been really close partners of ours that know those community groups, right? That work every day with organizations within their community that are their trusted partners that help to get the words out. So we'll really be working with our area agencies on aging to leverage their knowledge and with other partners that are part of this process. And I think you guys are a huge piece of that, right? That's part of why we have work groups, why we're doing this level of stakeholder engagement that does incorporate folks from a variety of sectors, from the public and private and philanthropy and state and local, is that we're trying to further our reach. So we're asking for your assistance in doing that as well. So we kind of are already building out a variety of organizational contacts that we're reaching for target populations. One of those target populations, for example, that's strong in my mind is organized labor, making sure that we are reaching the organizations. We as a state have great access already to organized labor, and we know that a lot of our partners, especially our association partners, have those connections as well. And so, for example, when we're doing our town halls and our outreach, we're making sure we're not just going through our traditional networks and reaching folks in that way, but we're actually contacting organizations, having conversations, building a relationship so that somebody doesn't see an email and just pass through it, but really understands the potential value of it, can give us feedback on how to reach people, or can facilitate that connection directly. Betsy asks, is there a reason why you don't use Zoom more? User-friendly community as well. Oh, are you saying the tool Zoom? Is there a reason why we don't use the tool Zoom? I'm not sure I'm understanding that question, but if that's the question, it is a good one. There's lots of really accessible tools. We really at the Department of Aging are using the resources we have available, which are Google Meets. And we're hoping that with the modifications that we've requested to be able to make this tool more accessible, it works. But of course, like we talked about, we're finding it's not always working for all of our purposes. So I think we are going to have to start using additional resources potentially, but we're also constrained by the budget that we have available. So I would say one of the things that we're trying to do, be cognizant of and smart about, is that, like, for our virtual town halls we have coming up during the public comment period, to partner with organizations that, one, have reach into new populations that we might not be reaching alone, and two, have other tools that might be able to be accessible in ways that our platform may not, for having multiple components open and different features. So we are planning to do our town halls very happily in great partnership with Maryland nonprofits and also with AARP. And there's a question, if I'm a point of contact for submitting stakeholders, yes, please. I'll put my my email in the chat. Hopefully you guys have it, but I am very happy to, receive feedback on here's a great community leader, a great organization you should reach out to. Here's a great introduction into this community. And I'm also, really encourage folks that are part of this process to engage in outreach directly as well.
Fran asked, what group is taking the lead to finalize the plan?
So the Department of Aging is the lead on this entire process. But of course, there are many things within the plan. As you review it, you'll see, are not traditional Department of Aging areas of work. So for example, there's a whole area around transportation. That's not an area that we have sort of direct funding for and direct impact on, but luckily the Department of Transportation on the state level is a fantastic partner. And there are existing platforms that bring human services agencies together with transportation that we can build upon. So we are actively involved in those groups. I think I've mentioned a couple of times on these calls, there are over 120 committees, advisories, councils that are part of state government. We are doing our best to identify opportunities to leverage those conversations to go where the work is already taking place, is already being reported on, and really advocate for the use of our plan to guide further multi-sector work. There's a question about whether I'm available to speak with groups, networks, et cetera, virtually. We are hoping to be in as many rooms as possible during the March period, but we are also specifically developing this toolkit, understanding that, we can't reach every room. We're a pretty small team here at the Department of Aging. We don't have a budget for this work. So we're really trying to leverage our partnership. So I would say potentially, and also we want to facilitate you to feel comfortable to bring your network together as well. One of the things that we've been discussing a lot as a group is making sure that we are taking sufficient time, and I included that in the comments around implementation, taking sufficient time over the next several months to a year to really get out into the community and tell people about this plan. Because if we don't tell people about it, they don't know it's there, and we don't have all the relationships built up yet. All right, and this is the last question because I know we got to move on. So Jim asked, can you talk more about the amount of metrics and outcomes that will be shared in the March plan? So I would say, we are focused on building out the metrics over the coming year, and most of that level of detail is going to be embedded in our website. So we are creating the plan so it can be a product, but also so that it's interactive with ongoing reporting. So we will be including metrics for each area, but we really see that as a starting point that we can build upon, and that we will be doing that interactively, utilizing our website as a tool. All right. So cognizant of time, I'm going to move forward. I'm really sorry that the chat function didn't work out here, folks, and that limited our time. Let me get back over here. All right, so we're going to move on and talk about the data dashboard. All right, so the Maryland Departments of Aging and Planning have been working to create an interactive data dashboard that integrates core data about Maryland's aging population and the social and environmental determinants of health that impact our state's longevity readiness. We envision this tool will help to guide statewide planning efforts to promote integrated policies, services, and programs that are consistent with the aims of the multi-sector plan on aging at the state and local levels. The project overall is led by Alfred Sindara, Director of State Data and Analysis Center at the Maryland Department of Planning. And Jonathan Jenkins, who works closely with the Department of Planning on the development of the dashboard, is going to walk us through some of the features today. We'll pass it over to you.
Good morning, everybody. Well, morning, afternoon. Oh, crap. Last time we did this in the morning, so sorry about that. Same as last time, Al, I saw that you joined. Would you like to give a hello to the rest of the team and whatnot and say something?
Yeah, thank you, Jonathan. This is Al Sundara with the Department of Planning. Happy to be here and would be happy to answer any questions about the dashboard that Jonathan is going to present. Thank you, Jonathan.
Excellent. All right. So, as Liz pointed out, my name is Jonathan Jenkins, and I work for the Maryland Department of Aging. I'm responsible for a program called Senior Call Check. And in parallel to the work that many of you have been doing on the work groups, we've been building the LRM dashboard to be able to be a means for us to track our progress with what we do within the aging network as a whole and how LRM is performing over the 10-year period that, of course, the strategic plan has been in place. This screen is your landing screen, essentially, which is, please note, this is a proof of concept. You're on the show the value of the work, all right? So this snapshot is where you'd fall if you hit the dashboard today. And it has three major topics that I like to point out. One, demographics, two, economics, and three, the health and wellness snapshot. Depending on who you are, what you're looking for, and especially what you're interested in within the work that we do and the work that we're attempting to achieve within LRM, you'll be able to gain a good understanding about where we are today from this snapshot and hopefully project for the future. I personally gravitate towards the economic snapshot when it comes to data on the screen, whereas some other people may be gravitating towards the demographic snapshot. A message and a powerful story that can come from data when presented is, for me, the gross domestic product, GDP, which is tied to us as older adults as we grow older. Granted, I'm not an older adult, but I will be there one day. Is to recognize what power we have behind what we do and how we do it. 39% of the people currently who are age 50 and up are living and carrying the GDP of Maryland. If that's true, by 2050, how much more would we be giving economic strength to those people? It's around 43%. So that shows that it's not just older people need help. Older people are here and we are supporting the economic growth of our country on a daily basis. However, we also have another metric right beneath it, which is the nursing home costs at $146,000 and the in-home care costs that are tied to that as well. Another message from this snapshot shows how much money are we taking out of an individual and then coming down to, I'm trying to think of the best word to say, out of their pockets and leaving them from being able to support themselves, their families, or any other loved ones that may be associated. Notice one thing for the stream. I apologize. I'm managing the stream while giving my presentation. So for those of you on YouTube, we'll make some changes. I apologize. Anyway, now with the demographic snapshot, for me, I also like to jump onto this message. How many older adults will exist in the state of Maryland by the time of 2040? 26% of the state will be there. By 2030, which is just in 5 years, we're already at 26%. So the number grew between 2020 and 2030, not necessarily 2020 and 2040. With your 10-year plan, in 2050, what is that number going to be? Will it skyrocket again and be higher, lower, etc.? It's good to know, but there's no way for you to be able to prove that without data. And that's the point of the dashboard. Next slide, please. With that data, we have census data versus projection data. The census data that you're seeing here is the demographics of Maryland as a whole. In 2020, this is the layout and the distribution of age groups across the state. The visualization power of Tableau allows us to clearly show your age groups of males and females, 10-year gaps between, let's say at the bottom, 85 plus, 75 to 84, etc., as you go down the list, and where those people tend to live. Baltimore City, that does not mean simply because it's white that there are no older adults living there currently. It's just comparatively to the rest of the numbers, there are fewer than Kent County, for example. So where could people be currently? If you take notice to the top of the screen, you'll see the year 2020 is listed. Race, ethnicity, percentage versus values are also available. You can change from the census data to projection data in 2045 from the Maryland Department of Planning to show where those older adults may migrate to or stay living in place and be able to plan effectively for the next 10 years coming. There are additional resource sorry. There are additional resource pieces that are here on the screen, such as the resource map on the right-hand side, which adds to the heat map. I did not add those here currently because I didn't have a story to tell with where are the hospitals right now. But remember that anytime that you're dealing with data, you can make a number say virtually anything. The question is, what do you want it to say? So if we go to the next slide, you'll note that I like the story, again, back to economic strength. Where is the median income of the state as a whole? Looking at this screen, you'll note that unlike the previous screen, which is county-based, we can get all the way down to zip code-based as well. And it shows the collection and pull of money. The average Marylander, looking at the bar chart at the bottom, makes between $50,000 and $100,000 a year. However, where's the distribution of wealth actually come at? I'm going to take note because I did get a comment by email in our prior presentation that this chart stops at $200,000 as an income per year. And there are earners within the state that are higher than that. Just to give an explanation to that real quick, yes, Maryland has 11 billionaires who live in Maryland today. You are capable of Google searching that if you want to. However, because that would stretch the numbers and change things, realistically speaking, if you do millionaires, billionaires, it does modify how the data looks, and it doesn't give a clear understanding of a large population. So the put them together is just understanding how data is being read. That doesn't mean they're not accounted for. It's just because they are fringe, we don't put them directly inside the bell curve here. That said, median income in general is what this is showing for all individuals living in the state. However, it's still a good way for you to be able to target where your resources should be going when you're building your programs, coming up with your strategic goals and outcomes. Next slide, please. With that in mind, adding to the goals of Maryland, which is understanding the housing issues, I'm going to use the word issues that we have, and of course, the way that we're planning to address those needs is all about understanding twofold. One, how much are people spending on housing? Two, where is the housing at? And three, what type of living conditions do they have? The first portion of that is, to my opinion, is going to be how much you're spending of your paycheck. If we tie the previous data, correlating information together, $50,000 to $100,000 a year is the bell curve for people living in the state. Of that, how much money do they spend on literally housing? I see a message in the chat, I apologize. Based on age group, some people are spending from 30% or more when it comes to their actual income simply to live. And the reason why we actually show that is because there is no adjustment for cost of living when you say income. You may make $70,000 a year, but if you spend 50% of that, what do you have left for food, other expenses, entertainment, luxuries of life that speak to your quality of life? If you go to the next slide, please. We're capable of targeting our information from the large Maryland view. And prior, I had not shown this. We can go straight to the counties and see that adjustment for the bar chart. What is the difference between one county, such as Montgomery County versus Kent County, and where people have enough money in their pockets, potentially, in order to live a quality of life based on their income? Next slide, please. Taking that, adding to the next variable I spoke to before, which is their living arrangements. You have a home, you're living in some type of scenario that you have shelter, but are you living alone? Are you living with relatives? Are you living with a spouse or roommates potentially? What does that mean? And how does that affect your health outcomes, your living outcomes, your conditions outcomes, and your financial outcomes? The great part, in my personal opinion, of taking these three things together is recognizing how much money you have, what you spend that money on potentially, and your living conditions when it comes to planning for your overall outcomes in the future. We talk about people living in place, aging in place. Are you living alone and aging in place? And we have to address social isolation potentially. Are you living with a spouse? And thinking about what that's going to be impacting your financial situation while you both try to survive together efficiently and effectively. Next slide. With that, I always like to point out Montgomery County. We do have a lot of people who are part of the work groups who either are or serve Montgomery County. And in that case, I always like to address that majority, 50% or more people living in Montgomery County live with their spouse. There are five total counties in Maryland that have 50% more who do not specifically live alone. And these are usually the larger counties, such as Baltimore County and Baltimore City. The smaller counties, or rural counties, I shouldn't say smaller, I apologize, do have more isolation with people living alone in certain scenarios or living with relatives. And it's something simply to acknowledge that we all do have, one, different living situations and conditions, and then two, how's that impacting our outcomes? The stories that you can come up with using data is kind of going to be up to you, but having enough data to support that story is very important. On their own, these are all standalone data sets, but combining them underneath the objectives and strategies that we've been coming up with is going to tell the story and give weight to an argument when we speak to a law policymaker, stakeholders, and others who may be interested parties. Next slide, please. So if we go back to the snapshot page when I got to speaking, I showed that there was health and wellness at the bottom. Under medical conditions, I like to pair the high cholesterol piece along with diabetes, primarily because if you go all the way back to that snapshot page at the bottom, it did say that Maryland has an obesity problem. We're lower than most of the country, but we're at 32% obesity. Two common variables that we speak to for obesity is high cholesterol and diabetes. Take a moment and look at this map. Your eyes should direct to the darkest county here. And then next slide, Liz. Diabetes and high cholesterol are very prevalent on the eastern shore of Maryland. In both cases, if you were to compare the bar charts, Dorchester County has the highest diabetes and the third highest high cholesterol when it comes to health outcomes based on things that we could potentially do something about. Many nutrition programs and other programs exist out there that attempt to address these conditions or outcomes that we have based on our lifestyles, and naturally having a true understanding of where we have the most prevalent problems is more efficient to allow us to move resources to where they should be to get better outcomes for Marylanders. Next slide, please. So with the dashboard, the question that I have for all of you, and the question that I would get to anybody when you're looking at data is, one, can you see your work within the data that was selected here? Based on what you do on a daily basis, based on the things that you advocate for, if one of the variables that have been presented to you in this POC is present, then we got parts of it right. Do we know we need to do better? Yes. Most of the data that's sitting on the dashboard currently is census data. The Department of Planning, Department of Maryland, Department of Aging are reaching out to other departments in Maryland to pull in data and aggregate it to be more focused specifically on Maryland. That said, we're still working at it. If you have data points that you are aware of or interested in, let us know. Reach out to me, and I'll put my email in the chat. Reach out to Liz, and of course, we continue to grow that process. But know that similar to how our plan is not ready for public circulation, neither is the dashboard. The moment it is standing as a proof of concept. However, we are moving to a point where this dashboard will directly reflect the KPIs of your objectives and strategies that you came up with. So that way this dashboard aligns 100% with the plan as it comes out. Great. I have no closer. I lost it. I apologize. Questions?
So we have a question in the chat, and remember, please, folks, put them in the chat, and our apologies for not being able to unmute right now. We'll figure that out. We have a question from Mary Jo Deering at WAVE. Do we have data on social connectedness?
That's an interesting question, Mary Jo. Social connectedness, I can't think of a good data point off the top of my head. I'd be interested in exploring that. if you have something in mind based on that question, Mary Jo.
And please do feel free to follow up via email when you do have examples. We've been going through a long process here saying, oh, we'd like to have data on this. And look, we know about this survey, but we do have standards. The Department of Planning has standards for, what we can include, and it includes things like, is there a history of data here? What's the methodology of collecting this data? And Al can tell us more about that. But that's part of how decisions are made. Another question, will we truly be able to know who is receiving what services and from what department? For example, perishable food access versus non-perishable food access.
That would definitely come down to the reporting of the program. So similar to us at the Maryland Department of Aging, programmatic level data will live with the program manager, and it simply depends on whether or not there's a public facing associated with that. So if there is a public facing associated to data and that department is in some way, shape, or form willing to share and already has some type of dashboard, we can integrate. I think one thing I'd like to point out just for a quick moment is we want data that goes statewide across all the different counties in some way, shape, or form. So that way we're presenting the same message for Marylanders as a whole. I just want to add that one piece. So if you do have something that's coming out of one county, but another county isn't actually receiving that, I don't think it would go directly on the dashboard. That doesn't mean it can't be referenced in some way. So please still reach out. But I just want you to have that in your mind when you're thinking about data. It needs to be countywide, all counties in Maryland.
And a follow-up question from Jane, will departments be requested for this information? I'm guessing that's, are we talking to other departments and requesting data that we can include on the dashboard?
So yes, top of mind at the moment, the Department of Transportation, Department of Commerce, for example, I have meetings already set up with for next week, and there are many other departments that we are already engaging to get multi-sector, multi-departmental data tied into the dashboard.
Thank you for your questions so far. Anyone else have questions that you want to enter into the chat, or comments, concerns?
I am checking YouTube currently because I've been off that screen. I apologize.
Thank you.
Nothing from YouTube.
Okay. There's a question about what % of the Maryland Department of Aging employees are older adults. It's related to outcomes. I don't have that percentage in my mind, but I can follow up with you on that. I'm interested in what percentage of the overall state employees are older adults as well. I think that's a real opportunity. This has been an exciting process of just learning about what data is out there, whether it ends up on the dashboard or somewhere else. And we've learned some really interesting data points around sort of the difference in the amount of time people stay in the job based on age. So how frequently people transition. Which for me as a member of state leadership is a really interesting opportunity, I think, for us to be recruiting and bringing in older workers into this state, to reduce things like transition, which really improves our efficiency and our effectiveness, and I think is a real opportunity for recruitment, where we have some vacancies, which we certainly do here at the state. Another question, was hoping to know where the gaps are. For example, personal care services in Montgomery County is available, but is needed for other counties. So I think, Jane, you're a little ahead of us when it comes to services. Right now, we're using core data sets for planning purposes. I think future phases are going to be more about incorporating an understanding of service data. It's also, what's exciting about what's going on in this administration is that the big points is data-driven and heart-led, and that means that all state agencies are being directed to have greater planning around data and greater access to that information. There is a Maryland State Data Portal that has a lot more around service data, and we are trying to, as we do that planning, as I talked about, when I mentioned the implementation, this kind of coming phase, within the next 10 years of our initiative is really going to be about kind of understanding those data initiatives, as they grow, there's a whole effort here at the state to improve the state's data maturity and transparency. And so the opportunity to gain that data is going to grow, but we're not there yet. Other questions and comments? Yeah, give a couple more minutes because I know it takes longer to type something into a chat than to raise your hand.
I went ahead and put my email in the chat as well. So if you have dashboard related or data related type questions, go ahead and send them to me as well. Obviously, we'll send them to Liz if you prefer or are comfortable, and we'll go from there.
All right, good. So thank you guys very much for joining us today. Apologies for the technical difficulties. Following this conversation, I think in about 10 minutes, you're going to receive an email that will include a link to the plan. That plan content is really for you only. Please don't share it around at this point. And you'll also receive a link to a survey to give us your feedback about the goals, objectives, and strategies, and also the data dashboard, including if you think that there are data points that we should include, whether you have specific information on that data point or just something you really want to see, like I really want to see this service, and look, it's right here in your plan, and here's some ideas about how to find it. We're very appreciative of the feedback, and we appreciate you taking the time to join us today. We look forward to continuing to work with you. Have a good one.